You may be asking yourself, what caused my blood pressure to increase like this? Unfortunately, the answer is not a simple one, as the cause of hypertension is very much multifactorial and often not attributed to one single cause. In fact, in about 95% of patients, the cause of their hypertension is idiopathic. This means that there is not one single identifiable cause for their hypertension. There are, however, several risk factors that may predispose certain individuals to development of this disease. Let's briefly explore a few of the most common risk factors. The first one we will touch on is age. This may be somewhat intuitive, but as you get older, the natural wear and tear on your body leads to increased risk of you developing higher blood pressures. Your diet also can have a profound impact on your blood pressure. In particular, research shows that the amount of salt that is present in your diet has been positively associated with higher blood pressures. That is to say, the more salt you eat, the more likely you are to have high blood pressure. When we think about salt in our food, we often just think about the salt shaker, but the reality is that lots of food contains salt already. Most foods that are sold in cans, boxes, jars, or bags are processed foods and contain salt. Long-term alcohol use can damage the body in many ways. Studies indicate that one of those ways is by having an adverse effect on your blood pressure and causing it to rise over time. As is the case with many health problems, a person's weight or BMI can lead to issues with hypertension. Studies have found that there is a significant correlation between higher BMI values and increased blood pressures. On a similar, although not exclusively correlated note, research has also indicated that a sedentary lifestyle has an inverse correlation with the incidence and prevalence of high blood pressure. That is to say that the less active an individual is, the more likely they are to develop hypertension. The opposite can be true here too, as research has also shown that physical fitness and exercise are correlated with lower incidence of hypertension. Smoking tobacco products has been shown to have a small impact on blood pressure. However, when combined with other risk factors that may lead to adverse cardiac events, like a heart attack, smoking and hypertension have been found to have a synergistic relationship. This means that those who smoking with hypertension puts you at greater risk of an event. For this reason, smoking should be avoided in individuals who have been diagnosed with hypertension. As I stated earlier, there often is no one single cause that led to your hypertension. The disease likely progressed due to one, or multiple of these risk factors that we discussed. If you have further questions, feel free to discuss with your provider. Now that we have a clearer understanding of the definition, risk factors for development, and diagnostic criteria behind hypertension, the next video will dive deeper into the negative effects it can have on your body. The fact is, hypertension is referred to as a silent killer. This means that most of the time, there is no obvious symptoms that will alert you to the harmful effects going on within your body. The next video will discuss the wide range of negative effects that high blood pressure can have, and hopefully leave you with a clearer understanding of why you should take this disease very seriously.
Created using Powtoon.